The month of February is Heart Health Awareness Month. For this month's Health Check, I'm joined by the WVU Medicine Camden Clark Medical Center's Director of Cardiovascular Service, Christina Brooks, to learn more about heart health awareness. Dr. Brooks, thank you so much for sitting down with me.
Thank you. I'm really happy to be here with you today. I am the Director of Cardiovascular Services, and I'm a nurse by trade, and I've been a cardiac nurse for many years, so this is something that's near and dear to my heart and a passion of mine.
Absolutely. So February being Heart Health Awareness Month, can you just tell us a little bit about the impact and the importance that heart health has on everyday life?
Absolutely. I kind of like to make the analogy like you have a car that has to have a healthy engine to run.
Right.
Our heart is the pump of our body, and if we don't have a healthy heart, it's just like having an unhealthy engine and you have car problems. You can't get from point A to B, and in order to live a full, happy, healthy life, we have to have heart health.
Absolutely. And so I want to turn our attention to some of the risks that comes to heart health as well. Can you just talk about heart disease, heart attack, and related lifestyles and family history, how that all plays a factor into our heart health?
Yeah. So number one, the biggest indicator of you potentially having heart disease in the future is your family history.
Right.
So if you've got that in your family tree, then you know that that's a possibility for you. Now, we can't change our genetics, obviously.
Right.
What we can do is work to change some of the other factors that can be contributors to heart disease. Number one, maintaining a healthy weight. Obesity is a big risk factor for heart disease. Smoking, excessive alcohol intake, high cholesterol, dietary choices such as eating foods that are high in saturated fats or refined sugars, highly processed foods, a sedentary lifestyle also can contribute to heart disease.
Absolutely. And so now I want to turn our attention to, you just talked about lifestyle changes. Now for people that maybe want to test themselves, go see a doctor, what are the best routes to do that?
Well, first of all, I think it's really important that you have a primary care physician who's your partner in your health and maintaining a healthy health status. So if you feel like you're having some kind of heart problem, that's your first step, is reaching out to your primary care physician and getting in to see him or her. And just depending on your symptoms, your family history, and your risk factors, that'll determine what the next course of action would be.
Absolutely. And so what are some of the common signs of a heart attack, and are there differences for men and women?
Yeah, so I like to use the acronym ACT NOW. So ACT NOW, A is for discomfort in your arm, or it could go up into your jaw. And so C is for pressure in your chest. Some people describe it as a crushing pain, a lot of pressure in the chest, you just can't take a breath. T is for pain in the throat, teeth, or jaw. N is for severe nausea, or sometimes people even have episodes of vomiting, as well as indigestion. And O is for oxygen. So if you feel like you just can't catch your breath and you're just very short of breath, that can be a sign that something's going on. And W is just an overall feeling of weakness or fatigue. With women can present a lot differently than men. A lot of the original studies on heart attacks and symptoms were done on men. And so those classic symptoms of chest pain, crushing chest pain, jaw, neck and arm pain sometimes don't present like that at all in women. So women might instead have pain that's in the middle of their back.
Oh, wow.
They might have pain that feels, or not even pain, maybe a tightness, like a band. A lot of women will describe it as like around their bra line. And the innocuous kind of symptoms like the nausea and GI symptoms will come with women, and they might write that off as something else. And so it's really important that women know that they might experience very different symptoms in those classic symptoms.
Absolutely. And in a non-emergency situation, for someone who might be a bystander to a loved one dealing with a heart-related issue, what might be the best case scenario, best way for them to help that person?
Well, I think if you suspect that someone's having a heart attack, there's no such thing as non-emergent. If you think you're having a cardiac event right then and there, then you really do need to call 911. Sometimes I think people think, oh, I might get them in the car and get them to the hospital quicker. Getting emergency medical services to your home, they can start care immediately, and they also have the benefit of being able to talk to the hospital and let them know that you're on the way. And that does a couple of things. It prepares the ED for you coming in, and it also activates our cath lab. So that gets the right people there to be able to take care of you quickly and restore the flow to the muscle of your heart, and so you don't have long-term damage. What you don't want to do is get in the car and drive yourself. You might feel like you'll make it, but you're at high risk of losing consciousness, and you could, cause an accident for yourself or other people on the road. So call EMS, get them there, get transported to the hospital.
All right, Dr. Brooks, now is there anything else you'd like to share about Heart Health Awareness Month before I let you go?
I think really it's important that you start addressing your risk factors and really work towards living that healthy lifestyle, whether or not that's managing your weight or stopping smoking. You need to have those conversations with your physician. If you're a diabetic, it's really important that you control your blood sugar and that you eat a healthy diet and maintain as low stress as you can in your life.
Absolutely, and stress is a key word, Dr. Brooks, because in part 2, in 2 weeks, you'll be sitting down with me again, and we'll be talking about how stress can affect your heart health. Dr. Brooks, thank you so much for sitting down with me and sharing your wealth of knowledge on this topic.
It was a pleasure, thank you.
Of course. When we return Mid-Ohio Valley, Kirk Greenfield will have another look at your forecast. Stay with us.